السلام عليكم ورحمة الله وبركاته. معكم دكتورة أميرة مرسي، مدرس بكلية تمريض جامعة عين شمس، تمريض الأمومة وأمراض النساء. In the previous lecture we talked the postpartum physiological changes. Now in this lecture we speak about postpartum management. The nursing care during this period of time help the parturient or laboring woman to restore her physical, psychological health, as well as gain experience in caring for herself and newborn through the health education of the midwife. Now we speak about postpartum care. The initial postpartum care. The aim of this care to minimize the risk of infection, hemorrhage, and pain. It is done through the following: fundus and Loggia assessment. As we speaking in the previous lecture, the fundal level immediately after delivery is between the midway between symphysis pubis and umbilicus, and within an hour it is just above the level of umbilical, and after 24 hours it is decreased approximately about centimeters or 1 finger breadth per day, and in the 5th day after delivery it becomes pelvic organ and can be palpated. Regarding to the Loggia, we discussing the definition of Loggia and 3 types of Loggia: Loggia rubra, Loggia serosa, Loggia alba. Uterine massage. It is used to increase the contractility of the uterus to decrease postpartum hemorrhage. Give oxygen therapy, IV fluid to prevent dehydration, and blood test for anemia and RH incompatibility or isoionization. Administration of tocolytic drugs or augmentation drugs that promote or enhance the contraction of the uterus to expel out the content of pregnancy to prevent postpartum hemorrhage. The second aim for initial postpartum period is to minimize the risk of eclampsia. It is done through frequent assessment for blood pressure. It is done every 6 hours if it is normal. Severe or persistent headache should be assessed and evaluated to consider preeclampsia. If diastolic blood pressure above 90 should frequently assessed. If accompanied by with other signs such as headache, edema, proteinuria, it is considered emergency and the emergency action should be taken. The third part in the initial postpartum care is to minimize the risk of thromboembolism or DVT thrombus formation through early ambulation, assessment for signs of DVT or deep vena thrombosis, assessment of Homan's signs, assessment of breathing and chest. The nursing management for the puerperium or postpartum woman for satisfy early needs of the woman through observation and recording of vital signs by check vital signs 2 times daily, morning and evening. Also by observing for symptoms of hypovolemic shock and hemorrhage, especially hypotension and increased heart rate or tachycardia. A temperature of 38 degrees centigrade or above for 2 consecutive days after the first 24 hours of delivery is considered an early sign of puerperal infection or postpartum infection or puerperal sepsis. A bradycardia is normal psychological phenomenon, as we said in the previous lecture. After observation of the vital signs, it is important to assess the uterus and uterine condition through palpate the uterus daily to assess the firmness and the hardness of the uterus, either the level of fundus and the rate of involution of the uterus. As we talked in the previous lecture, the involution of uterus refers to the return of the uterus to nearly pre-pregnancy condition and size. Also, it should be well contracted, central, and involuted gradually at the rate of about 1 cm daily during the first 7 to 10th day of the puerperium. And after the 10th day after delivery, it considered a pelvic organ and can be palpated. After observation and assessment of vital signs and the uterus, it is important to assess the breast condition. The breasts are examined to note their consistency and the signs of infection, which is called mastitis. That means inflammation of the breast tissue. In breastfeeding mothers, the amount and the flow of milk and the condition of nipple and the areola should be observed. The normal is protruded nipple. It shouldn't be inverted nipple, that is mean الحلمة المقلوبة أو المعكوسة. Now we speak about observation of the perineum. Observe the perineum and suture line if present in case of episiotomy for redness, ecchymosis, and edema or gapping, which is called Reda scale. For check healing and cleanliness. During examination, the hemorrhoid may be noted due to increased intra-abdominal pressure during pregnancy, and the gravid uterus also may be due to increased intra-abdominal pressure during delivery as a result of peering down. If it is present, it should be appropriately treated immediately. Regarding to the lochia, it is important to check the lochia for color, amount, odor, consistency, and the blood clots. As we talked in the previous lecture, the lochia divided into three types. The first one, lochia rubra, that is red in color and remains or lasts for 1 to 4th day after delivery, and it may be or sometimes extended to 7th day after delivery. Then the lochia serosa, it is pinkish yellow in color and it is extended for another 3 to 4 days after the lochia rubra. Then the lochia alba, it is creamy or white in color and maybe remains about 10th day postpartum. Regarding to the amount, it shouldn't be a severe amount. And regarding to the blood clots, it shouldn't be contain any blood clots. This lecture helped the nurse or midwife to assess the amount of lochia. It is considered scant amount if the bed soaked by about less than 1 inch, and considered light amount if less than 4 inches, and considered moderate amount if less than 6 inch. And heavy amount if saturated within 1 hour. The next point, after observation of vital signs, uterus, breast, and lochia assessment, it is important to assess urine output. The urine output is usually recorded for the first 24 hours after delivery to ensure that the woman is passing an adequate amount of urine, and there is no tear or injury or laceration of the urethra or the bladder. Also the leg. Regarding to the leg, the midwife examined the patient leg for pain and edema and signs of DVT or deep venous thrombosis. After observation of the previous items, it is important to maintain the rest and sleep for postpartum women, because provide for sufficient period of rest and sleep to maintain physical and mental health. Also promote the lactation, as by sleeping 8 hours night time and 2 hours afternoon nap or are needed. afternoon nap اللي هي القيلولة اللي هي بعد الظهر، اللي هي 2 ساعتين ولا حاجة بعد الظهر، بعد كده 8 ساعات بالليل وساعتين بعد الظهر، بعد كده حوالي 10 ساعات في اليوم. After observation and rest and sleep, the woman also need the proper diet. Through provide diet high in protein and calories to restore the tissue healing after delivery. A daily requirement of 3,000 to 3,500 calories per day. It is needed for in the form of well-balanced diet that rich in protein, calcium, iron, and vitamins. Liberal or increased amount of fluid are required. The daily fluid intake should be 2.5 to 3 liters in form of milk or juice. The fourth need for postpartum women after the proper diet is hygiene. The woman should be taking shower daily. The vulva and perineal care include washing or swabbing with a warm water, and the antiseptic solution is important, as the area must be kept clean and dry and free from infection. Also, breast care should be done before and after feeding. The nurse teaches the mother the technique of breast care and encourages her to initiate breastfeeding.